A cancer diagnosis can feel completely overwhelming, and for those who are managing careers, raising children, and trying to maintain their households, undergoing treatment can be an added challenge, to say the least. But what if the key to not just surviving, but truly thriving through treatment was a simple human connection? Our guest today wants to share a solution that helps people face those challenges that go beyond traditional cancer care. Let's welcome Darcy Wells, President and CEO of Can Care. Good to have you, Darcy. Thanks for joining us today.
Thank you so much for having me.
Of course. Darcy, with cancer rates rising among younger adults, what unique challenges do these patients face that traditional support systems often maybe miss out on?
Oh, absolutely. Great question. So, if you're facing, let's say a 35-year-old mom is facing cancer, her challenges are much different than someone who is diagnosed later in life. They may have young children, aging parents they're caring for. And so the complications of life surrounding their cancer treatment are much more complex. So they need different kinds of support and especially different kinds of emotional support in their cancer journey.
And to that point, how does genuine emotional support really translate to better physical health outcomes during treatment?
We long thought that providing emotional support was a great thing to do, and that's why Can Care has been doing that for 35 years. But now research has actually shown that those people who have emotional support and feel supported and feel understood in their cancer journey have better health outcomes.
Mm.
And that's so important as we're facing what Harvard researchers are calling an epidemic of younger people facing cancer. So we really have to surround these people with the emotional support that they need during this cancer journey.
And you really focus on that because I understand that the heart of your model is matching patients with a survivor who truly understands their journey and what they're going through. So why is that shared experience so powerful?
You can be surrounded by family and friends during a cancer journey, but even those who have that will tell you if they haven't had someone who really understands what they're going through, it can be incredibly lonely, it can be incredibly frightening. So, having that survivor by their side, someone who says, I've been there, I've been through the exact same type of treatment you're going through, I've faced that same kind of challenge of telling my children about my cancer journey, can be quite the sigh of relief and provide a level of comfort that no one else in your network or your family can really provide you.
Yeah, it's someone that truly gets it and can understand those waves of emotions and obstacles that you might be going through. And for a busy professional or parent, how do your free and flexible services fit into an already kind of overwhelming schedule for somebody who might be battling cancer?
Absolutely. So, anyone facing cancer can reach out to us. It is a free service, or healthcare professionals can also refer you to Can Care for emotional support. And then you are matched with a very sophisticated algorithm with volunteers all across the country so that we can find the best volunteer for you who has experienced really exactly what you're experiencing your same diagnosis, treatment, stage of life, and challenges, so that you truly have someone to support you in your cancer journey who has walked that exact same path, someone you can confidentially ask questions to,
Yeah.
and really express fears and emotions that maybe you're not comfortable expressing to your family and friends.
And for someone feeling isolated after a diagnosis, just getting that can be a lot. So how quickly can they connect with someone? And what does that first conversation feel like for people who have done this?
Usually, the connection can be made within 2 to 3 days because we really work quickly to find the best match for you. And our clients tell us it's like a sigh of relief when they can connect with that person who truly has been there, and they have someone who will just listen. They'll listen and really understand. And maybe it's someone they can ask questions to about how did you experience this? What did you do when you were going in for this kinds of treatment? Someone who really has been there and can give them some tips and tricks that they did in their cancer journey that might be helpful for them.
Yeah, definitely. I think, again, when family finds out that a loved one is diagnosed with cancer, there's sympathy there, but to be able to actually speak to somebody who gets it and that path that you're going towards, it's just helpful to have somebody that can guide you with that aspect of things. Darcy, such great work that you're doing. I'm going to let our viewers know where they can go for more information. Thank you again for your time. And to our viewers, every patient should be surrounded by a community that cares, like Darcy mentioned. For more information, visit cancare.org.